Hi, I'm Lana Gordon, and I'm talking about maximizing your HEADDSS, ways to make your adolescent HEADDSS exam fit into your primary care office. So in this talk, we're going to learn how to reinforce providing an adolescent-friendly care in the primary care setting, how to identify conflicting agendas, and how to be able to leverage a HEADDSS exam to provide a high-yield, efficient adolescent visit. We're going to talk through the things that you may need to refer to specialty care versus the things that can be addressed in primary care. I have no significant financial disclosures to relate according to this talk. So I'm going to introduce you to Hailey. Hailey is a young person who you know. She's 15. She's been coming to your practice for her entire life. She's the middle child in a family with 3 children, and you've been taking care of all of their children. She presents today at the office with her dad. So one of the first things that you can do to kind of de-escalate some of the conflicting agendas that can happen in an adolescent visit is making sure that your practice is adolescent friendly. So if you can have an adolescent waiting room, that's great, but there are other things that you can do that don't require changing around the space. It's the approach to the patient. So having signs and posters that reflect diversity, having education for both the parents and the teen that talk about confidentiality and the importance of it, and then making as few barriers as possible for a teen to come in to be seen. So whether that be allowing them to come in alone, allowing after school hours, or even evening hours, minimizing wait times for appointments, and trying to make sure that a teen's always able to come into the office within 48 hours are super important, because for teens, the moment to strike is when the iron is hot, and usually that's within the first 48 hours, as close as possible to that time period. So every single state has areas that adolescents have confidentiality around, and these are kind of the big 7 that all of the states have laws around. Now, the laws that you see in the comment section, these are related to Florida law because that's where I'm practicing, and it does vary by state. However, if you go to the Guttmacher Institute, you'll actually find really good information relevant to your state, and it's a great resource because they keep it updated monthly. However, we generally think about adolescents as having confidentiality beginning at the age of 12. So when we think about what is a HEADDSS exam, a HEADDSS exam is thinking about the adolescent environment and where there are different areas of potential strength as well as risk. It's really important to remember that it's a screening tool. It is not the only tool. It's a way to let you figure out where are the areas you need to take a deeper dive. So you may spend a lot of time on one letter and not a lot of time on another, depending on how the conversation is going. Some contemporaries use shades instead of heads. It's the same information, but a more of a strength-based approach. And so starting out with an adolescent in terms of thinking about what makes them resilient. And we know the most important common denominator for an adolescent to be resilient is their connection to a caring adult. I would argue that the caring adult is not just their parents, but it's the other people within their community, and also you as their provider. So helping identify those caring adult connections is what promotes adolescent resiliency, regardless of the decisions that they make. So when thinking about, well, what should you refer? When you're thinking about home education and activities, anytime that you're worried you can't offer confidentiality, anytime that you're going to screen for something and you're not sure what you would do with a positive result, or anytime that you get information that it feels like there's more there, but you can't quite sort through what it is, you may need what we call a deeper dive, then those are patients who are good patients for adolescent medicine. We have a little bit more time to conduct that HEADDSS and maybe figure out where the underlying issue is and if there are other resources that are needed for that young person. When thinking about the E or eating, you may want to refer when you think that there's a suspicion of an eating disorder. And that may be not that the growth chart shows that they're severely underweight, but instead you have a growth chart that shows that there's not really a gain in weight, or there's a significant weight loss, but it's not done in a healthy manner. Or a young person who, as you're talking about foods, talks a lot about healthy versus unhealthy foods, is very rigid in what they'll eat. These are young people who may not be under the 3rd percentile, but at the same time have an unhealthy relationship with food, and they may indeed have an eating disorder. And so adolescent medicine may be able to help you sort through that faster. When thinking about substance abuse or drugs, anytime you see a young person who's using substances at a young age, so under the age of 15, anytime you see a young person who's using an excessive amount of substances, so they're blacking out, they're riding in cars with people who are using substances, they're using substances to fit in, they're getting in trouble with the law or other important adults, then that could be signs of excessive substance use. They're experimenting with concerning substances. So young people in the US are commonly using alcohol, marijuana, and less so tobacco-based products. But if you're seeing a young person who's using heroin, who's using cocaine, those are young people who need to be referred immediately. And then any sign of addiction or physical dependence, again, they should be going to a dedicated substance abuse program. When thinking about sexuality, you want to think about any time that you see a young person who's a sexual minority youth and they need an environment where they feel safe. It may not be that you're uncomfortable treating sexual minority youth, but it may be that the young person is uncomfortable exploring this new topic for themselves with you. Anytime you're screening in any relationship and there's a discordant power balance, anytime there's signs of intimate partner violence, or if you're concerned that there's a youth who's being trafficked. When thinking about STDs, anytime that there's a need for confidential testing, you have a patient who has an STD but they have symptoms, they're not responding to treatment, or you need to observe treatment because they cannot pick up treatment from a pharmacy. Those are young people who you would want to refer to adolescent medicine or to like your health department or Planned Parenthood, places where they can offer confidential STD treatment on site. In terms of contraception, you might want to refer if there's concerns around confidentiality. Anytime that there are period problems, so the period seems long, it seems really severe, the teen's not sure what type of contraception they want to use and they need a more in-depth conversation. You're concerned that they may have a medical condition that would limit the type of contraception that they have, or they desire long-acting reversible contraception and you don't know how to place those in your practice. Those are great teens to refer to adolescent medicine and other resources for contraception. For the S of psychology, when we think about when do we want to refer teens around that, anytime you screen and find out about self-injurious behaviors, that's a teen who needs to be seeing a psychologist. Anytime that you get a largely positive screen on depression or an anxiety screen, that's a teen who needs to see psychiatry. Anytime you hear about suicidality, that's a teen that needs to go to the emergency room. And then when you hear about multiple risky behaviors, a parent who's resistant to mental health conditions, or a teen who's having trouble with adjustment, those are teens who are well suited for going to adolescent medicine. So in summary, there are many different Haileys that you're going to encounter. That's why each of the Haileys on these slides that look different. And that's because adolescents are diverse. They're individuals who are unique. You can get a lot accomplished in 20 minutes as long as you have the right scripts, you're authentic, and you'll share your agenda. But again, if you don't ask, then you won't know. So it's all about what you find out in the HEADDSS exam. Don't assume that because a teenager is mature or low risk in one area, that they would be mature or low risk in all areas. Remembering that teens may be having sex even if they're not telling you. And so if you're not getting positive results on your STI screening, then it probably means you're not screening enough. So thinking about other creative ways to get more screening in. And then finally, adolescent medicine is always a subspecialty that's willing to provide additional support and resources and specialty care for teens who are engaging in behaviors that are risky or that you're not sure if something's quite right. That concludes my talk about the adolescent HEADDSS exam and how to maximize it in your private practice. Thank you for listening.